This will be the video for the MMT of knee flexion. There are 3 muscles that contribute to knee flexion, which are the hamstrings group, so the biceps femoris, the long and the short head, the semitendinosus, and the semimembranosus. The biceps femoris long head originates at the ischium and the sacrotuberous ligament and inserts at the lateral aspect of the fibular head and the fibular collateral ligament and is innervated by the tibial branch of the sciatic nerve. The short head of the biceps femoris originates at the lateral condyle and the linea aspera of the femur and the lateral intramuscular septum and inserts at the lateral condyle of the tibia and is innervated by the common perineal branch of the sciatic nerve. The semitendinosus originates at the inferior medial aspect of the ischiotuberosity and inserts at the proximal shaft of the tibia, the pes anserinus, and the deep fascia of the leg, and is innervated by the tibial branch of the sciatic nerve. And the semimembranosus originates at the ischiotuberosity, the sacrotuberous ligament, and inserts at the medial condyle of the tibia, the distal aponeurosis, and the oblique popliteal ligament, and is also innervated by the tibial branch of the sciatic nerve. So this is going to be the MMT test for knee flexion. To start with knee flexion, there are going to be 3 different tests that we have to do. We have to do the hamstring group as a whole, we have to do the medial hamstring group, and then the lateral hamstring group. But all of the tests for them are the same, so I'm going to do them all at the same time, but I'll tell you which one's which. So for a grade 3, you're going to have your patient laying in prone with their toes off the edge of the bed. This is going to be our test leg. So you are going to ask the patient to bend their knee, bringing their heel up towards their bum. Beautiful. That is going to be a grade 3 for your hamstrings as a whole. The next one you're going to have them do is you're going to have them internally rotate your hips, so bring your toes in and then try to do the same movement. That is a grade 3 for the medial group. And then you're going to have them turn their toes outward, so your hip is externally rotated, bringing up again for another grade 3. Perfect. So for grade 4 and 5, we're going to stay in this position. We are going to come back and have the patient bend their leg to about 45 degrees. We're going to keep the toes straight to test the hamstrings group as a whole. Don't let me move you down, okay? Moderate resistance would be a grade 4. Maximal resistance would be a grade 5. And then the same thing here, you're going to have them internally rotate by turning those toes in, and you're going to provide a down and outward pressure. Don't let me pull you down. Grade 4, grade 5 for the medial group. For the lateral group, you're going to turn out again, and this time you're going to pull down and in, so don't let me pull you down. Grade 4, grade 5, moderate resistance, maximal resistance. We'll bring this leg back down. For a grade 2 test, you're going to have your patient in side lying. So I'm going to have him roll towards me, and we're going to test this leg for a grade 2 just because of the setup that we have. But ideally, you would obviously be testing the same test leg. But for this one, you are going to lift up and support the patient's leg. Beautiful, give me your leg. And then you're going to have them try to bring their heel in towards their bum. So bend your knee for me. So against gravity, full range of motion would be a grade 2. And then you're going to roll back on your belly for a grade 1. Come back to the test leg here. I am going to bend his leg up for him, and then I am palpating the tendons of the hamstring at the medial and lateral aspect of the back of the knee and having him attempt to pull his heel in towards his bum, bending the knee. You're feeling for a contraction there. If you feel a contraction, that's a grade 1. If there's no contraction, that's a grade 0.